You're absolutely right, because the biggest risk factor or comorbidity going forward is really obesity and diabetes mellitus.
Absolutely. And the whole cardiometabolic profile, and Steve, that's what when we were doing the research for this, and we began to, I'm just tell the audience, to uncover research that had been sitting there since the 70s. And we started connecting the dots, seeing that this condition, insulin resistance, which I'm sure we'll get into and explain, but this condition, just take it as a label right now, it's called insulin resistance. 88% of Americans have it to some degree. Probably the conservative numbers are 52% of the world. I think that's an understatement. I think it's closer to what it is in America. So you've got the most common metabolic condition in the world, and it is a very bad thing because it leads to prediabetes, diabetes, heart disease, obesity, even Alzheimer's, which are now calling type 3 diabetes. And when I saw that this particular risk factor, so much more than cholesterol, shows up 10 years before the heart attack, shows up and can be tracked for a decade before your doctor says to you, Mrs. Jones, your cholesterol is high, or your diabetes doctor says, Mrs. Jones, your A1C is going up. This thing is visible years before, and it's treatable, reversible, preventable with diet. And we're not talking about it. And why is it relevant now? Because that condition underlies every comorbidity for COVID. And that's why I think that if we handled this condition, if we stopped chasing an old-fashioned measure for cholesterol and started looking at this very serious underlying condition that makes us vulnerable, that makes us immunocompromised, that makes us fat around the middle, that makes us diabetic, sick, fat, and tired and depressed, if we started looking at that condition and taking simple steps to turn it around, which can be done so easily with a change in diet, we would probably wipe out half of the cardiometabolic diseases in the world.